Health Matters Now, a malaria advocacy group under the aegis of civil society in malaria control, immunization and nutrition, has appealed to the Ogun State government to support primary health care in the state. The health group made the appeal on the sidelines of a media briefing on Global Fund Malaria Accountability and Advocacy Project in Abeokuta, the Ogun State capital. Now, speaking through its leaders, the group commended the Ogun State government for its intervention in the health sector, with an appeal to the government to make good its promise of renovating one health center per ward. They also decried the inadequate funding for malaria interventions, staff shortage and death of drugs and long-lasting insecticide-treated nets in some health facilities. Now, while restating the group's commitments to advocating best practices for malaria control, the state's program officer, Akomin Chika Obioma, called for more support for Community Development Association and Ward Development Committees.
Increase funding for malaria intervention by government, both at the state level and the local government level. We also appeal to Ogun State government to expedite action on its promise to renovate and ensure at least one functional health facility in each ward. We are particularly bringing Ogun State government attention to the fact that the health facility at Abule Oloni needs urgent attention. That's in Abeokuta South.
Then, issue of malaria, the major thing is prevention. And prevention starts from me and you, from the community. During the rainy season, we know the grass, they grow very well. Let's cut and let's sweep our environment. Make it clean. We don't allow stagnant water. All this will prevent malaria. Luckily now we are entering the dry season. Definitely the growth of the production of mosquitoes will reduce.
Akomin is a national network of civil society organizations working on the prevention, treatment and mitigation of the impact of malaria, as well as the promotion of immunization and better nutrition in Nigeria.